Thank you for joining us. We have just a couple minutes until the presentation begins. We'll let everyone get a chance to get logged on and situated.
Well, there's a clock there.
All right, we will go ahead and get started. Thank you for joining us this afternoon. This is our presentation, Diabetic Patients, Description of Diabetes Management During COVID-19 Illness. My name is Brianna Gilger. This is Juanita Horn and Esperanza Garza, and we are being joined by Emma Shima, who is on the Zoom call as well. This presentation is being recorded and will be uploaded to YouTube at a later date. The title of the video will be the same of today's presentation. The objectives for our presentation today are first to discuss the risk of severe COVID-19 illness for individuals with diabetes mellitus. We will then describe the methodology and findings of this original research study. We will identify themes regarding patients' perspectives of how they manage their diabetes during an acute COVID-19 illness. And lastly, we will reflect on how healthcare providers can improve education for their patients and the overall lessons learned from this research process. We will start by understanding the problem. Much is known about diabetes during acute illness, with the most common emergent complication being diabetic ketoacidosis and hyperosmolar hyperglycemic syndrome. Education provided to patients about these two complications consists of early identification. This is done through encouraging patients to routinely test ketones in their urine and to check their blood sugar often. Their insulin management may also be impacted and change from provider to provider with that discretion during illness. However, diabetes and COVID-19 have a unique relationship. Landstra and de Koning describe diabetes as being characterized by glucose dysregulation caused by an absolute or relative insulin deficiency. Researchers theorize that in patients with COVID-19, the cytokine storm induced by SARS-CoV-2 heightens due to the underlying inflammatory process in patients with diabetes, specifically those with unregulated blood glucose levels. As you may know, glucose dysregulation can lead to hyperglycemia, which also impacts immune system function, which can lead to an increased risk of infection for these patients. In fact, patients who have a pre-existing comorbidity at the time of COVID-19, specifically diabetes mellitus, are at a higher risk of severe disease course, which potentially requires hospitalization. As of now, it is unknown how diabetic patients manage their diabetes during a COVID-19 illness. The purpose of this study was to gain insight into how these diabetic patients manage their diabetes during an acute episode of COVID-19. Our research question is as followed. From the perspective of a diabetic patient who had a confirmed case of COVID-19, how did they manage their pre-existing diabetes mellitus during their acute illness with COVID-19? We will then move into our methodology section. Our study design was a qualitative research with phenomenological approach, and it was focused on Nola Pender's health promotion model. Protection of participants was gained through IRB approval, and participants all consented to participate in the study with an informed consent document. Our sample was selected from adults for ages 18 years or older from the United States of America who reported having a pre-existing diagnosis of diabetes mellitus at the time of their COVID-19 illness. All participants self-selected to participate in the study via a link that was shared on social media. This study took place from the dates of October 21st, 2022 through November 5th, 2022. Our data, as previously stated, was collected via social media on an electronic link. The link went to a Google form questionnaire that we developed, which consisted of demographic data and open-ended questions that we asked the patients to describe their management of diabetes mellitus while they were sick with COVID-19. Our original goal was to have 20 participants in our study. However, after 10 respondents were submitted to our study, it was determined to be a satisfactory sample size as no new data had emerged. And then thematic analysis was performed to identify patterns in their responses.
And now we'll take a look at the findings that we had. So first we wanted to get some demographics of what these respondents looked like, see if we found any similar backgrounds between them. So looking into that, we can see that 70% of our respondents identified as female and 30% responded identifying as male. We had a pretty good spread for age, ranging from 18 to 64 years of age, most of them falling into those older categories. So you can see the spread on our ages there. We also wanted to ask about their ethnicity, race, and where these people came from. 80% of our respondents stated that they were white, 10% were Hispanic, and another 10% classified as multiracial Hispanic. And those were all self-identified from the respondents. We also asked about location because we wanted to see if there were any differences between rural or urban settings, if they had education about their management of diabetes during COVID illness. So we had respondents ranging from towns that only had a few hundred people to a city like Wichita, Kansas, that has about a population of 400,000 people. So it was really awesome to see the different sizes of towns and cities from our respondents. We also asked what type of diabetes our respondents had. 60% identified as type 2, 30% identified as type 1, and one respondent stated that they had type 1.5. We also asked when they were diagnosed with diabetes to see if this person was used to maybe regulating their diabetes. So those respondents stated they were diagnosed between 1995 and 2022. That 22 was an outlier, and our respondents, everyone else had been diagnosed for at least 6 years or earlier. So that one was a fairly new diagnosis. These are the open-ended questions that we asked our respondents. On a day-to-day basis, how do you manage your diabetes at home? How did you manage your diabetes during COVID-19? Were you hospitalized while you had COVID-19? If so, what were you hospitalized for? Did you receive any information about how to manage your diabetes specifically related to COVID-19? If so, what information did you receive and from whom? And finally, during COVID-19 illness, did you have access to resources on how to manage your diabetes? If so, what resources?
And then at this point, we went into breaking down those specific questions a little bit further from each respondent. And as you can see, in regards to their daily management, we had 9 respondents who stated they used medication, and that varied from insulin pumps to insulin use, oral medication, weekly GP1 or glimepiride, and some just stated medication, but they did not specify a route. We had 5 respondents state that diet was how they managed it, 2 specifically stating diet, 2 stated eating healthy, and 1 stating watch what I eat. We had 3 respondents who reported using continuous glucose monitoring, 2 stated Dexcom, and the 3rd respondent just stated occasional CGM use, and that was unspecified. 1 respondent stated walking as a source of their management, while 2 were kind of just some descriptors. Well, the 1 stated very well, and the second one stated, I believe my management is decent. So with regard to how participants managed their diabetes during their COVID-19 illness, you can see here where we had 6 the respondents stated that it was unchanged. 1 stated, I used the same technology as previously stated, aside from Control IQ, as I didn't have the technology available to me at that time. I noticed abnormal fluctuation in my blood sugar from time to time, but assumed that it was caused by schedule changes while quarantining at home. 2 reported they hardly ate. 1 responded with rest, meds, herbal teas, and walking, and 1 reported being asymptomatic. All of our participants denied being hospitalized during their COVID-19 illness. In regards to the information that they received as far as managing their diabetes during their COVID-19 illness, all of our participants stated, 8 of our participants stated no, while 1 stated very little information. What I did find was on social media, and another stated that they had reached out to their health department if there were any tips on how to control their diabetes. When I was diagnosed with COVID the first time and was told they had no trustworthy information they could give. And then when asked about their access to resources during their COVID-19 illness, 5 respondents stated no, 4 of them specifically just stating no, while the 5th one stated none readily offered. We had 3 report that their healthcare providers were a resource to them. We had 2 state that they had online resources, 1 specifically stating social media, while the second one stated online information, and 1 respondent reported that they had access but didn't need it.
And then moving into our conclusions. So after reviewing the responses that we received from our participants, we saw a theme. These findings suggested that there were gaps in education provided to diabetic patients related to management of their diabetes during an acute course of COVID-19. All participants reported that they did not receive education about managing their diabetes during COVID-19. This is important to note because we all know that with chronic conditions such as diabetes, we are more vulnerable when it comes to an acute illness. In fact, we had some research that we found that stated individuals with diabetes mellitus are at an increased risk of severe illness if they acquire COVID-19 in comparison to individuals who do not have diabetes. These studies also mentioned that a well-managed blood glucose level decreases risk of complications. There is a need for healthcare professionals to ensure education is provided to and understood by the diabetic patients to help them manage their diabetic care. So lessons learned. With every type of research, there's always things that could be improved and things that we would ask or change. So further inquiry, if this study would have been repeated, there are things that we would want to ask and things we would want to specify. So as a group, we come up with a couple of questions. So we would want to ask, when were you diagnosed with COVID-19? This is important to us because we could better understand what material they could have even been provided. Because if this was at the beginning of COVID, maybe they didn't have a lot that could have been shared with these patients. But if it was towards the end of COVID, is there really an end? But if it was towards the end here, we would maybe have some more opportunities and more research and education that we could have shared. And then for the other questions that we would ask, we would want them to describe their symptoms and severity of COVID illness. We did ask if they were hospitalized, but we would want to ask a little bit more of a specific question to see if we had mild, moderate, or severe cases as part of our study. And then, did your blood glucose levels change during COVID-19? What interventions did you use to manage your blood glucose levels? We would want to ask this since the research showed us that those with better controlled blood sugars had better outcomes and less complications. And then lastly, we would want to ask, did you test positive for COVID-19 on a laboratory confirmed test or a home test? This would be important to note because if they did do an at-home test, we would want to know, did you tell your provider? If the provider didn't know, maybe they weren't able to even provide that information to them. Healthcare providers are a primary resource to patients with both chronic and acute illnesses. The findings of this study provide insight into gaps in diabetic management, specifically education related to diabetic management during COVID-19 illness. Knowing what gaps exist from the patient's perspective regarding diabetic management during an acute illness such as COVID-19 may help healthcare providers provide more comprehensive education during diabetic management.
All right, and these are our references. We will now open it up to any questions that the participants may have.
I have a question, kind of. You said in your discussion that none of the patients in your study received any education, and then Emma did kind of talk on it later when she talked about the difference between the laboratory or the home test. Do you think that had your patients talked to their provider or alerted them that they had COVID, that maybe the education would be different?
I would hope so, especially if they already have an established endocrinologist, maybe that they would see that. But depending on what app they use, I don't know if providers are automatically keyed into that result. I'd have to see what healthcare app they were using, like let's say Epic in my chart, it shows up. I don't know if the provider is necessarily alerted to that. So that'd be something to look into.
Yeah.
Absolutely.
I think also depending on the patient, if this is someone who has chronic issues with their diabetes management, I feel like if their provider had been alerted and knew that they were had tested positive for COVID, that they would maybe be more inclined to provide that education and continue to follow up with them.
Definitely. Thank you.
Thank you.
I have a question, and you did talk about kind of your lessons learned about doing this research. What was one of the takeaways that you have from doing this research?
In retrospect, obviously, there were questions that I think and that we decided as a group would have been very beneficial to ask, specifically what timeline when the individuals had COVID. As we all know, there's been a lot of changes in the last 2 years alone. And I think that dramatically impacts the resources that healthcare providers had available to them to then provide education to patients. So as Emma previously stated, depending on what that timeline looked like, I think that could have had an impact on the education that patients received. One other takeaway that I personally had was in looking through responses, we had a couple questions that we had initially envisioned as being a yes or no question. However, we left them open-ended for respondents to give additional information. But it almost made it a little bit difficult on some responses because it seemed like we kind of got some tangent answers. So I think if this study were to be repeated, I would maybe break those into separate questions. So we have a clear yes or no that they have to pick one answer or the other, and then they can provide additional information in a follow-up question.
Or even a rephrasing of some questions, like one of them was, how do you manage your diabetes, or something along those lines. 9 out of our 10 participants described what they did to manage it, and one participant said, very well, which, yes, they did manage it very well, which is great, but we wanted to know how. So maybe a rephrasing of some of those things could have been good as well.
Sure, and that's in retrospect, after we complete something and we look back upon it, it's really easy then to identify that maybe someone didn't understand what we thought was very clear. So thank you for sharing that.
All right, do we have any other questions?
Awesome. Well, thank you everybody for coming today.
Yes.
Thank you so much for taking the time.
Thank you.
Thank you for sharing this important research with us.
Absolutely. And we will, as previously stated, we will be posting this recording to YouTube, and the name of the presentation will be the same as today. So it should be easy to find. Thank you so much. And I hope everyone has a wonderful evening.
Thank you.
Bye-bye now.